Welcome everybody to the Scottish Ambulance Service annual review, and thank you very much for attending. There's a number of people in the room, but there's also a number of people joining virtually. I'm Jenny Minto. I'm the Minister for Public Health and Women's Health, and it's been my pleasure to meet with clinical team and also the staff team as well earlier this morning. I'm joined by John Burns, the Chief Operating Officer for NHS Scotland, Tim McDonnell, Primary Care Director, attending from the Scottish Government. He's joining virtually, and also Rebecca Chalmers and William Tennant, both of the Scottish Government unit that works closely with the Scottish Ambulance Service. I'm also joined by Scottish Ambulance Service representatives, Tom Steele, Chair, and Michael Dixon, Chief Executive. Every year, the Scottish Government conducts annual reviews of the various health boards, including the Scottish Ambulance Service. And these reviews are really to ensure that the local services that are being delivered are being delivered effectively in the preceding year, but also looking at what could be happening in the future year, both developments and challenges. This is part of the Scottish Government's way of holding our National Health Service boards to account for the amount of public money that they receive. And the public sessions are structured to allow the service to provide an overview, looking at their priority areas, and also an opportunity for some questions and answers, which I will chair. I will ask either the Chair or the Chief Executive to respond, and I should be very clear at the outset that it's not appropriate to ask about patient-specific issues in public, but we are very happy for these to be followed up with board officials after the review. We've also had a number of questions that have been submitted from the public beforehand, including patient and carers, and I will put these questions to the board leadership first before taking questions from the floor. Once this is complete, I will also be attending a private session with the board leadership, and that will move into a more detailed discussion about performance. And the main points from today's meetings will be covered in a letter to the service, which will be issued in the coming weeks and will be published on the board's website. So, Tom Steele, may I ask you to give your presentation, please?
Yeah, good afternoon, Minister. I've been privileged to chair the Scottish Ambulance Board for over 6 years now, and we continue to play an ever-growing part in healthcare across Scotland. I'd like to briefly go through some of the performance from last year and then talk about the focus at the moment. Technology has been a problem today, and it apparently continues to be so. Next slide, please. I think it'd be appropriate to talk about the demand last year. As you'll see from that slide, it's pretty stable. It's roughly up about 1% across the different categories. But to some extent, that hides a little bit of what's going on in terms of acuity. And you'll notice that the emergency ambulance responses have increased more than the 1%. And that plays to what's been happening over the last number of years, where the acuity of calls has significantly increased by about 70% for our top 3 acuity calls, whereas the non-life-threatening calls have decreased by about 40%. So there's a real swing since pre-COVID there. So although demand looks as though it's stable, it's actually less stable than it might appear. Inter-hospital transfers similarly have gone up significantly. That reflects a changing provision from hospitals, where they're more services being centralised and therefore more ambulance visits and ambulance transfers required from ourselves. Next slide, please. Just looking at our key achievements from last year, I'm pleased to say that 94% of calls were answered in less than 10 seconds. And that compares to 3 years ago when we were 82%. So there's been a significant improvement there. The call centre has become accredited centre of excellence, and last year won the UK Control Room Team of the Year. So good progress there, I would suggest. Most significantly, we are about saving lives, and the 30-day survival rate has improved on the purple category, the critically unwell patients. Please. And that improvement represents about 900 people in the year, which is a very significant increase in terms of critically unwell patients who survived for 30 days. The median response time to people in that critically ill category is 13 seconds last year, just above 7 seconds across the country. Interestingly as well, that the public access defib usage has increased, which along with Save Life for Scotland, British Heart Foundation, it's a big push for that to be improved, and we're glad to see that going up. I think that the numbers at the bottom there, very simply, approximately 50% of incidents do not result in conveyance to the hospital. And that's a very significant change over the last number of years. So 22% being dealt with remotely through the call centres, through the integrated hub, where we are able now to triage calls to much better effect through the use of GPs and paramedics, nurses and paramedics. And then the on-scene patients have been significantly affected by new pathways of care. So we can now direct to new pathways of care in the community, as well as enhancing our own skills to deal with patients. So that continues to improve, and I think it is very significant, not only in being better for patients, but taking pressure off the emergency department. Next slide, please. Key achievements. I'm very pleased to say that we hit our financial targets last year, both our efficiency targets and our capital targets, resulting in revenue and capital being on target. Any shift coverage was also on target and up from last year. And that's a theme I'll come back to about compared to some of the other parts of the health service, we are finding it relatively easy to attract and retain the right people. Further signs of improvement, despite the pressure on hospital turnaround times, and I'll come to that in a moment, but we have improved, as you'll see, right across the 4 main categories. The pressures are still being felt in the yellow category, which is the non-emergency category, where because the pressures of turnaround times are not giving us the capacity that we would otherwise have had. However, we are working with boards, and I will come to that in a second. Next slide, please. This slide indicates across the emergency departments the median hospital turnaround times last year, and in grey is this current year. You will see the very significant variation. Some of the hospitals being much smaller than others, but for example, Ninewells is probably the largest hospital, which is below the line, whereas in the extreme left of that graph, Grampian, Ayrshire, Lanarkshire are areas of significant challenge. And particularly at Grampian, we are working very closely currently with Grampian Health Board. You'll have seen from their board minutes that there's a new test of change underway to try and reduce particularly turnaround times at acute receiving. where we believe that there's an opportunity to schedule the patients to much better effect rather than when they've already been seen by a clinician before arriving at hospital. So that is very much work in progress, but it is having an enormous effect on our capacity in the northeast. It would not be unusual for half the ambulances available in Grampian to be queuing at that hospital. And you can imagine the impact not only on the patients in the ambulances, but the patients to whom we don't get to in a continuous manner. And you'll note also on that left box that average turnaround times continue to increase this year. And the grey lines on that graph are a concern to us. We're working extremely hard with many of the boards to mitigate this to good effect in quite a number of areas, but it still remains our biggest operational pressure by far. Next slide, please. Other challenges, and when I say challenges, I don't really mean areas of failure. I mean literally challenges that we address within the Scottish Ambulance Service. These were our challenges last year, and they will continue to be this year and next year. I'll talk more of the top two in a second, but cyber and business continuity is very important to us, obviously, because time is of the essence in much of what we do. The cyber in particular is an area where we have put a lot of effort. We have high NIST scores, but importantly, I mean, I personally was caught recently when the department put out a scam email which I failed to deal with appropriately. And that really brought it home, and I'm sure some of my colleagues, hopefully some of my colleagues would also agree that it really makes it count when you realise just how easy it would be. So it's an area that we're taking so seriously. And the dynamic nature of the world in which we're working, the fragile services, which are, everyone knows there's areas of challenge right across the country, and we have to react to that because we're at the sharp end of emergency care. So it's a changing landscape and something we have to keep working with very closely with our colleagues, not just in the health boards, but in the health and social care partnerships and CCPs and right across really the whole network. Next slide, please. I'm not going to go through, you'll be pleased to hear, our strategy in any detail today, but I think what's important is that there's a golden thread from the strategy which this board, which I chair, developed a couple of years ago, taking us out to 2030. Reports that come to the board, the analysis of the risks which we face, and these are translated through to the activities of the executive team, which Michael leads. So I'm very confident that we have 5 portfolios on that there and 46 programs running, which we review not at every board, but through the year we review them in turn. Next slide, please. Some high deliverables for the current year. I'll just touch on some of these. Business as usual I've spoken about, and the challenges of business as usual, but the Scottish Ambulance Service is now doing so much more in healthcare across Scotland. So I've talked about turnaround times, but staff well-being clearly is extremely important. And these two things are linked because the fundamental kind of intention of our staff is to provide care to patients in the way they've been trained to provide it. And because turnaround times are such that they're not able to do that as much as they wanted, and therefore that is impacting on their productivity clearly, but also their well-being, because they're having to spend much longer looking after patients in an ambulance, and that's not what ambulances or indeed our staff are trained to do. So we're working very hard and have made good progress in break times, and they're, I think, improving significantly. But we still have staff overruns at the end of shifts, which means enforced overtime because the patients are in the ambulance, and not everywhere can we make a change at the right time of staff. We're also focusing very intentionally on sickness absence this year, which remains higher than we would like. But perhaps we don't know exactly the reasons why. There are pockets where that's much greater. There's the overarching activity that I've spoken about around turnaround time, but what else is going on? It's clearly a very challenging job, both mentally and physically. So we're doing a lot of data analysis at the moment to understand just why some people are experiencing long periods of absence, and for us to help them to get back to work and health more quickly. This year, our Best Value programme is, we believe, on track to deliver. We're working very closely with the Scottish Government and have recently had further funding to support programmes which we developed during COVID and which are adding to the efficiency of the whole healthcare system. And also working on the Scottish Government 15-box grid, which is being worked on across the country. So I'm pleased to say today that we hope to come in on target again financially, which I think will give you, I hope, Minister, confidence that investing in the ambulance service is put to good effect. The unscheduled care, the right time, the right place, that is the activity I've already spoken about, and working with the boards in terms of flow navigation centres, peer-to-peer support, ensuring that only the patients who need to go to the hospital go to the hospital, and others get appropriate care in the community. The drug harm, I think, is worth mentioning. Clearly, it's a high priority of the Scottish Government, and an area where, for example, in the Take Home Naloxone programme, the Scottish Ambulance Service has led on for the last number of years to good effect. Safe injecting now becoming an area which we continue to work and help with. And interesting, some of the statistics which we have around what drugs are being used, where are the pockets, looking at resilience with Public Health Scotland, we're making that's proving to be a new area which is giving us greater insights into just where the drug harm is happening to best effect. And I think it's a good use of not just our clinical areas, but actually the data which we have. Next slide, please. Some more high impact deliverables. The mental health continues to be an area where we're working closely with NHS 24 and with Police Scotland to reduce the number of people who inappropriately are taken to the emergency department and to create new pathways of care. Particularly, Scottish Government have funded us to have response cars and pathways in Inverness, Dundee, and Glasgow, and you'll be aware, Minister, of the End of Life Care programme supported by Macmillan. It won Team of the Year on Thursday night and the Health Awards, and there's 200 teams nominated. So I think we must be doing something right there. But it is an area which has perhaps not had the attention that it deserves. Too many people die in hospital. They don't wish to die in hospital. And working with hospices and care homes, we are making significant progress in allowing patients' wishes to be respected and for more people to die in circumstances that they would wish. Planned care is around our PTS, our patient transport systems, which we continue to invest in and ensure are most appropriately taking patients to hospital, but also taking patients from hospital and mitigating to some extent the late discharges, which cause flows through the hospital to be so difficult. I did touch on 24, but we work closely with NH24. We have a joint program board where we look at means of appropriately handling 99911 calls to best effect, and being able to transfer calls from the Scottish Ambulance Service to 24 rather than previously when the patient had to phone again, thereby making life much more effective and a better experience for the patient. And just before I end, Minister, the last 2 points I think are important. We in Scottish Ambulance Service are working with almost all the boards, the territorial board, in primary care or in out of hours. Somewhat ad hoc, well, we have contracts with them, but we believe that given the sustainability of our workforce, the graduate programme being supported by the Funding Council and producing funded for 300 plus graduates every year, and even if we have 200 graduates every year, that we are going to increase our workforce, our skilled workforce, who could, we believe, to effect work in out of hours areas, working with GPs and primary care, and at the front door of hospitals, in areas which are all currently workforce challenged elsewhere. So we're beginning to do some work around that. To look at our future workforce, more of what might be possible. And I'll just end with the thought that I would be delighted to work more closely with Scottish Government to see just what we might be able to do in this area where access currently is, as you know, very difficult. Thank you very much.
Great, thank you very much, Tom. A really helpful and informative presentation, really showing the breadth of work that the Scottish Ambulance Service is doing for the people of Scotland. I was very pleased to see the team win the Team of the Year on Thursday's award ceremony, and that is a very important partnership with Macmillan's, as well as hospices and health boards, very important. And if I may just alert people to the fact that the Scottish Government has got a palliative care consultation out just now, which closes on the 10th of January, so it would be helpful to get responses in on that. And I think the other work that you do supporting vaccinations within communities, and the very important that your work that you're doing on reducing drug harm and support within the community. So thank you very much. As somebody said to me earlier, the Scottish Ambulance Service can be described as the glue between primary and secondary care in the health service, and a very important glue it is too. So thank you very much, Tom. I'll now turn to the question and answer session. And the first question that has been written in, and I promise I didn't send it in, although as it starts, it could well be me. It says, I live on an island and I'm concerned about ambulance provision. What happens if all other ambulances are out answering calls and I need an ambulance in an emergency? So Michael, Tom.
I'm happy for Michael.
Yeah, it's and actually having lived on an island myself, I've it's that concern. So it's a relatively rare occurrence that we would have multiple operations on at the same time. Our ambulance control centres are excellent at prioritising activity, and actually the integration and the support we receive from our community first responders are critical in all of this. We acknowledge there's not an endless supply of ambulances, but there will be a degree of prioritisation if one job is able to be paused and that a more urgent job to be able to be taken on, then that will be the case of what happens. But on the whole, it is a relatively rare occurrence where we see greater demand, particularly in the island settings, than we actually have provision for.
Okay, thank you, Michael. And I suppose that really is replicated across a lot of rural Scotland as well. So clearly a concern, but yes, very helpful to get your response there. The second question, NHS boards say that prevention and more care at home are important factors in helping decrease the pressure on the front line of the NHS. Do you agree with this? And if so, how can the ambulance service help with this?
So to pick up one of the important work streams we're doing, which is our high intensity user programme, we're working with people who disproportionately would call the ambulance service more frequently. And by not seeing it as a punitive measure, but actually by understanding that there is an unmet need there, how do we work with them? How do we support them to effectively get them the best possible care that really meets their needs? 999 is a phenomenal service, and it is 24/7, 365. But maybe the best way to help them is not by just sending an ambulance. So it's an example of where prevention, and we're seeing huge impacts in terms of reducing call volumes from what is a relatively small number of people. Again, not punitive, but actually recognising that there are other ways we can meet their needs. And that's just one example of a programme of work that Scottish Ambulance Service do routinely.
And Michael, that was highlighted in the stats that Tom just ran through about the different types of call, with only about 47% actually having an ambulance sent out. Do you think the Scottish public understand that this is a change that you've made, and that it's actually a way of improving their service?
Well, I think it's really impressive. I've spent time in the Ambulance Control Centre as a senior leadership team, is how well those callers are dealt with. Time is taken to explain what the response will be, and it may not be that an ambulance will be sent. It may be there are alternative ways that we can help them, but all the way through, it's about good communication. Thankfully, we all don't have to phone ambulances on a regular basis, so not expecting people to understand what the process will be and how that works, which is why that really good communication from our call handlers is so important.
Yes, I would agree. And having visited your call centre at South Queensferry, I saw that in action, and also met some of the clinicians that are based there to help triage the calls. The next question is, will it become more and more common to call 999 and receive treatment over the phone or by video call?
So technology has a hugely important part to play in all of our future across healthcare. We already see there is an app that we would urge people to access, the Good Sam app, in the event of a cardiac arrest, that has a video capability.
What was the name of that app?
Good Sam.
Good Sam.
Yeah, Good Sam app that people can access. And we already use the video function that exists with that. We've got some excellent programs of work, but let's not forget we also use telephony. And telephony is a great way of communicating to people. And again, our call handlers are expert in getting the key messages. I've heard them talk through a really difficult situation, such as a resuscitation attempt, and they're calm and collective and talking people through. But there is huge opportunities to use video. We all already have a powerful computer in our phone that we can access that. The opportunities are huge. So I think that will be a very strong direction of travel.
Okay, that's helpful. I've got a few more questions that have been sent in, but I'm just wondering if I can open it up to, is there anybody in the room that specifically has a question? I'm not seeing any hands go up, so I will continue. Okay. I've heard patient transport services are decreasing, and Scottish Ambulance Service are putting extra limitations on who they can take, and how long will this service continue for patients?
So it's important to recognise our patient transport services are not a taxi service. That's fundamental to this. It's about providing the right care to patients who have clinical needs and require a clinically trained crew to provide their services to transport them from home to wherever they're receiving treatment. So the focus is on making sure that people can access that. We see some phenomenal community transport schemes in place, provided either locally or through voluntary third sector organisations that are really happy to engage with patients and help them meet their routine hospital appointment. And so it is about, in essence, making sure the right people are getting the right support from our services, rather than just seeing it as an ambulance-based taxi service.
Okay, which is an interesting term to end on, given that the next question is specifically asking about how long the Scottish Ambulance Service plans to keep using taxis for non-emergency calls. Is it a temporary measure, or is it going to continue?
So we have a duty of care to all patients that phone us, and we recognise there are certain circumstances where the only way a patient will be able to access appropriate treatment is for them to be able to have a taxi provided. We will try and explore with them all of the alternative options, be that a relative, be that a friend, be that a neighbour. But realistically, if the choice is, and you've heard about some of the pressures on our urgent care vehicle, if the choice is either sending an urgent care vehicle, potentially diverting away from a far more acute patient, or sending a taxi, it may well be appropriate for us to send a taxi.
Thank you for that. And Tom, in your presentation there, you talked about the importance of the relationship between your employees and the importance that they get the right support, because as you said, it is a challenging job both mentally and physically. So final question that I've been given is about ambulance technicians who want to train as paramedics are currently unable to access training places due to lack of funding. What steps will Scottish Ambulance Service take to make it easier for technicians to retrain as paramedics?
So this is twofold. There is already what I would consider informal routes that people can take on. We're seeing that across the service, where people are either moving to annualised contract or reducing their hours so they can attend university. It's one of the great benefits of university being free in Scotland. That means they maintain their wage and also are able to train whilst they're working. But there is a cohort of our workforce who desperately want to be paramedics, who want to use an earn as you learn route. Now, we're working closely with the Scottish Government about what that could look like, and there are similar programmes for healthcare assistance in the acute sector. So it's mirroring an already existing pathway that happens in other parts of NHS Scotland. But we're working on that, and that will take a little bit of time to get into place. There is a wider opportunity, which Tom referenced during the presentation, which is we think there is greater benefit that paramedics and Scottish Ambulance Service can provide to NHS Scotland, which is deploying paramedics in innovative new roles that we may not have considered, or building on programmes of work that already exist. For example, paramedics working in primary care in Dumfries and Galloway, excellent piece of work. So can we use more of that? Can we get their skills into different places and offset some of the other areas which are having extended and sustained workforce challenges? We'd like to see that programme work, but we're just going to make sure it's, and I use the phrase, right size. So are we meeting what Scottish Ambulance Services needs will be in the future, or are we thinking about a bigger programme which is about how we meet the needs where we can for the wider NHS in Scotland?
Okay, thank you very much, Michael. Thank you, Tom, as well. Just a quick check from the floor. Is there any further questions? In that case, thank you very much for coming along. Thank you to Tom Steele and Michael Dixon for your contributions. Very much appreciate people that have turned up in person, and also those that have joined us online. As I've said in my introduction, we will be writing a summary letter to the Scottish Ambulance Service as a result of today's meeting, and that will be made available on the board's website. So thank you all very much for attending, and thank you very much for the questions that have been submitted and your contributions. Thank you very much.